Are you there watching my video on the other side of the video land? This is Dr. Maddineni Srinivas. I'm your dermatology educator. So this is my YouTube channel. So if you have not yet subscribed to my YouTube channel, please do subscribe because in this videos I am going to make short videos explanations for the questions, great questions which will be asked in the future. So this is today's question. So here we are basically going to see treatment modalities of anogenital warts. So it is asking all except the treatment modalities. So please, if you have answered it as Kligman's formula, then awesome, you have answered it right. Why? Because trichloroacetic acid, podophyllin and also IMIQUIMOD, all of them are going to be utilized in the treatment of anogenital warts topically. So this is IMIQUIMOD, which is available in 5% formulation and it is used as topical formulation. So basically you should remember that there are no any oral medications which can be used either in the prophylaxis or the treatment of anogenital warts. Please remember this was the AIIMS 2020 MCQ. It's not a joke. So you should remember no oral medications for the treatment of anogenital warts. So it will depend whether if it is a male we can use whatever treatment modality we want, but if it is a female then if she comes with anogenital warts, if she is non-pregnant, then we can prescribe her two medication which can be used depending upon our own comfort. So we can use either podophyllin or we can use imiquimod. So both of them are having different mechanisms of action. Podophyllin it's available as 25% and imiquimod it is available as 5%, as I've already told you. And the mechanism of action of podophyllin basically is it is going to arrest at the cells at the metaphase level, and imiquimod it is going to have agonist action over the toll-like receptors, because of which there is going to be immunity promotion of immunity. And as the name itself suggests, it is imiquimod, so it will modulate the immunity. And what does it modulate? It is going to increase the immunity of the patient by having agonist action in the toll-like receptor 7, thereby which there will be release of cytokines like interferon alpha, tumor necrosis factor alpha and interleukin 6. Because of all of these, the patient's own immunity will get activated and it will try to kill the human papilloma virus. And please remember, the preferred agent among these two is also imiquimod 5% cream, but since it is little bit on the costlier side, the patient usually cannot afford it, so we do recommend even podophyllin. But if in the MCQ it comes, please answer it as imiquimod 5%, which is preferred over podophyllin. So there are 2% which you are able to see. 25% is going to be applied by the dermatologist or the patient, whereas this 0.5% it can be used by the patient him or herself at the home. Okay, and this is how it is going to be available. So please do subscribe if you have liked this kind of short explanations. So in the next slide we are going to see what can be done in a non-pregnant pregnant woman. We cannot use podophyllin or imiquimod. Why? Because both of them are having teratogenic potential, so we will avoid using them, and instead we can use this cryotherapy or trichloroacetic acid, amongst which cryotherapy is the better answer if both of them are given. And if it is question is asking pregnant woman, what you would do? So this cryotherapy, we will use liquid nitrogen, which is going to deliver the temperatures minus 196 degrees Celsius, thereby which it causes necrosis of the cells whichever get in contact with it, because of which the viral infected cells are going to get necrosed and die off. And this is also an important question. The percentage of trichloroacetic acid is 50 to 100%. This was asked in PG. So that's it in this short video, guys. If you like this short kind of videos, do subscribe to my YouTube channel. The link is